spot here. So happy belated Memorial Day and June 1st, everybody. It's finally feels like summer in the upper Midwest. And welcome to our 11th episode of Ewings U. For those of you that don't know me, I'm Piero Spada, and I'm going to be your co-host once again today. I'm also the co-founder of Little Warrior Foundation, and more importantly, father to 12-year-old little warrior, Lucy. If you're part of our core contingency, thanks for being with us here since day one and making this a place for positive change. And if you're new, welcome to Ewings U. It's our webinar series where we hear from leading experts and discuss with them the cutting edge of care and science for Ewing sarcoma. On that note, today we'll be hearing from Dr. Janet Panoch, a warrior mom turned PhD cancer researcher. Specifically, today we'll be exploring her newly created decision aid when considering surgical options of the lower extremity. In just a bit, Janet will define for us where exactly in the lower extremity this aid plays a role. And although this guide is optimized for osteosarcoma, it is still highly relevant for those with Ewing sarcoma. Briefly, Janet is currently a researcher in supportive oncology at Indiana University School of Medicine. She has a PhD in health communication and is particularly interested in surgical decision-making. Janet hopes to one day share the patient stories she's collected to help surgeons better understand the decision-making experience from the patient's perspective. Janet's interest in medicine is fueled by her daughter's experiences with bone cancer. Zoe had a limb salvage surgery in 2007 at the age of 12 and later chose an above-knee amputation for better quality of life in 2018. Since then, Janet has worked closely with many patients like Zoe who are either making a decision for the first surgery or years later for a different surgery. And I think, Janet, I just want to kind of stop and hit the pause button here because what I think this bio that you sent us, which is beautifully crafted, kind of glosses over is the fact that you went back and got your PhD after the fact. Is that correct?
That's true. That's true.
So I just kind of want to highlight, that's extremely difficult to do, but secondarily and more importantly, just thank you as a parent for going back and doing it in such a professional manner. It's highly admirable what you're doing and what you've created for the greater sarcoma community. So incredibly empowering stuff. So I just want to highlight that and thank you. Outside of her profession and her free time, Janet takes every opportunity to go fossil hunting, rock collecting, and kayaking along one of Indiana's many waterways. She is also an avid lover of live blues music. You had to throw that in there. And before we start things off, what that?
No, that's true. I'm glad you got to squeeze the blues in. Thank you.
For sure. And before we start things off with Janet, I just want to let everybody know and remind you all that Ewings U is a webinar and podcast production of the Little Warrior Foundation. We are a national childhood cancer foundation with a laser focus on finding a complete and permanent cure for Ewing sarcoma. We were founded in April of 2020, have now granted out $1.6 million in high potential therapies for increasing survivorship and decreasing toxicity. And in order for us at Little Warrior Foundation to make programs like this a reality, we rely on the support of the little and big warrior community alike. We appreciate all of the support so that we can continue our mission to bulldoze our way towards more effective, less toxic therapies and continue this vital work for kids battling Ewing sarcoma. And before I hand it off to you, Janet, I'm going to hand it to our co-host, Emily, and she's going to introduce herself and touch on a couple of housekeeping items.
Hi, everyone. I'm Emily McFadden, one of the co-founders of Little Warrior Foundation. I wanted to let you know that this webinar is being recorded, and we will make the recording available on our website under the blog section. And that is also where you can go to see past episodes and get some really great information. As Dr. Panoch is talking, you can use the Q&A function on Zoom on the lower bar to submit your questions, and we'll make sure to leave plenty of time for questions as we go. We can't get too deep into specific cases or provide direct medical advice on this webinar, but Dr. Panoch is very open and we can ask lots of great questions. We'll be sure to leave lots of time. So with that, I will turn it over to Janet.
Awesome. Well, thank you so much for that introduction. I love sort of the ad lib part. Not that I would advocate getting a PhD in your 40s. It took me, gosh, I think 7 years before I finally finished, but I knew that I needed to get the PhD for surgeons to take me seriously and to take this work seriously. So I'm glad I did go back. So what I'm going to do now is I just have a few slides to share that will give a little bit about the history of the development of the decision aid. I think it's important for our constituents and our families to understand that it's not just me that put this together, right? It's the entire community. It's the osteosarcoma community, it's the Ewing sarcoma community, and it's the healthcare providers who provide care for us, including physical therapists, prosthetists, and orthopedic oncologists. So I'm going to go ahead and start my slides. I just have about 7 of them to cover 16 years of research, so I'll kind of spin through those really quickly. Okay, so I started when my daughter was diagnosed with osteosarcoma in 2007, and so that's kind of the inception for the idea of the decision aid. So I was using both personal experience and my experience as a patient advocate. So Zoe was 12 when she was diagnosed, and she had limb salvage surgery. She wasn't given any options at that time. Her surgeon just said, "This is what we do." And I wasn't in medicine at the time, so I didn't know that I should ask questions or that there were even any other options around. It was a little after that we started having the Facebook osteosarcoma, Ewing sarcoma support group. So I joined those. And I started to notice kind of the common questions in the groups that included, not having enough information to make a decision, not having enough support, certainly not having enough time to make the decision. And meanwhile, Zoe was having chronic pain, limited mobility, frequent surgeries on her limb salvage leg that continued over 11 years. And every year she would ask her surgeon, can I just amputate? Can we just, I'm really interested in getting on with my life and having a prosthesis. And they always said, no, we can save the leg. Let's try one more surgery. But in 2018, after 11 years, she was able to choose an above knee amputation for a better quality of life. So she was 23 then, she's now 28, living in Washington, D.C., and lives a very active life in martial arts and with her friends in D.C. And so I started working on this project more avidly when I was doing my dissertation. And so I'm going to present 3 studies. This is the first one in 2020. And this was the patient and parent needs and recommendations for a decision aid. And so I just used part of this to talk about the decision aid, but I did do personal interviews with 29 people representing 20 families. And when I asked them, what would they like to see in a decision aid if they could have, a tool that would show them the different surgical options that were available to them, they said they would like to see it in different types of formats, right? Have it online, let it be available as an app, maybe a roadmap. They wanted images, animation, real patient stories, and it should be youth friendly. As far as the content, they recommended that we talk about the tumor location and how important that is to understanding what the surgical options were, what to expect long-term and over time, what the possible issues were with the different surgeries. They wanted some more information about insurance and how to navigate that, and then about prosthetics, because when we talk about the options of limb salvage surgery, amputation, and rotation plasty, we don't often talk about what life will be like with a prosthesis, and they felt that was really important. And then psychosocial support. They were looking for more online resources, in-person peer support, social media support, decision support, mental health support, those kinds of things. And here's a quote from the parent of a child who was 11 at diagnosis, who said, they think online would be best because it's a timely issue. What are the downsides of each one? You're told your child has cancer and in 6 weeks they're going to have a surgery and you have to make a decision right away. I think having it online, having some links to different people's stories, positive stories for each one of the surgeries, a clear list of the prospects and concerns and problems. So then in 2021, I did a similar study, this time with healthcare providers, looking at what their recommendations would be for a decision aid. But I actually asked 3 questions for them. So this was a 3-question survey. The first question was, what are the communication challenges that you have as a healthcare provider when presenting these options? And they said they had communication challenges primarily, staying unbiased while presenting all the options, balancing the family's need for information without overwhelming them, and then time constraints for counseling with families. When I asked them what did they think were the patients and the family's challenges when making the decisions, They said they struggle with emotions. There's parental guilt, weighing appearance versus function of options, limited information, a poor understanding of long-term outcomes, and the need for rehabilitation. And then when I asked them more specifically about what recommendations would they have for a decision aid, they said things that were similar to what the patients and families said, that it should be easy to use. It should use plain language, have illustrations and animations, patient stories, short-term and long-term complications of each option, and take a multidisciplinary approach that includes the physical therapist, prosthetist, and psychosocial support. So you can see how this really mirrored what the patient said. And this is from an orthopedic oncologist who said many patients need help thinking through their own values, such as what risks are they willing to take, and applying those values to their options. Patients can become overwhelmed quickly with too much information at once. And I think most of us can relate to that, having not come from the world of medicine. And then in 2021, that is when we received funding for this decision aid from the Osteosarcoma Collaborative. And then the last study, the third study in 2022, was actually a test of the prototype for the decision aid that you're going to see. And that decision aid followed, by the way, the International Patient Decision Aid Standards. And so this study was an open-ended survey of 8 sections for the prototype. And the themes were about the content. They felt the content was clear and they liked the testimonials, the support links, long-term outcomes, but they disliked a noted bias and they felt it needed more evidence and references. In the first iteration of the tool, I had a clear bias toward one option as opposed to the other 2. And so we tried harder in the last version to make that more balanced. Another theme was the structure. They really liked the bullet points and the organization. There were checklists, the color blocking they liked, but they felt it could be better organized, more interactive, or rearranged differently. For the visuals, they liked the images, the PDFs, and the layout, but they disliked the lack of diversity and wanted more photos and videos. And then for accessibility, they liked that it was well written, easy to read and understand, but felt it could be overwhelming and was very text heavy with inconsistent size for the fonts. One was feedback we got from an adult patient said, I like the intro, the questions, practice statements with printable PDF options and links to support. This tab is great. I wish I had some of these questions or thought prompts given to me prior to surgery. So those were the 3 studies, and now we're at 2023. The decision aid has been revised to 4 sections instead of 8, and we've started our implementation. So the 4 sections are, the first one's making your decision with common questions like, why am I even making a surgical decision, right? 5 steps to making the decision and making the decision for your child. Section 2 is know your options with the 3 main options of rotationplasty, limb salvage, and amputation, pros, cons, and possible issues with each. There's personal stories and resources in this section and social support to connect with families. You and your surgeon is all about communication, pace, how to talk to your surgeon, second opinions, 20 questions to ask your surgeon. Those were all worked on by the community members. And then section 4, life after surgery, thinking long-term about what matters most to you over time for yourself or for your child. Life with amputation and rotationplasty and a prosthesis, life with limb salvage surgery and other surgeries that might come after that. And then finally, a big chunk of resources, including Little Warriors and MIB agents and some of those kinds of groups that people may not be aware of. And so now we're at the implementation plan. We released the decision aid to the public on May 1st to the support groups, the Facebook groups, and to institutions. So for over the last 16 years, developed a number of relationships with orthopedic oncologists, pediatric oncologists, physical therapists, and so on. So the decision aid was released to all of those people and all of those groups. And we are tracking data with optional patient interviews before and after surgery. So we have some data that we're tracking through analytics, but there's also a survey that's available to people who've not yet made the decision because we want to see how this is useful to them over time. So we're doing an interview before they make the decision and then again after the surgery takes place. And so this is where we're at now as far as the dissemination. This has been in the last month. We're at 915 site visits. And you can see with the numbers down below that 643 of those are in the United States, but we are getting worldwide attention, worldwide visits. And this is a number of countries that we have reached, 42 countries, which was beyond my expectations. I really didn't expect to get this many folks looking at it. They are responding with whether or not they're patients or parents or providers. So we're still gathering that data. And so I'm going to pause right now for just a minute and see if anybody has any questions about the development. And then we will move on to the decision aid itself.
We haven't had any questions come through the chat.
Sorry, I think I didn't hear what you said, Emily. I saw
I said we haven't had any questions coming
Okay.
through the chat. So
Okay, great. Well, I am going to go on and start the decision aid. Technical difficulties. Give me 1 minute. Okay. Okay, so the decision aid starts with the home page. So there's a home page. Here's the 4 sections that I just mentioned: making your decision, know your options, you and your surgeon, life after surgery. And the website is just osteosarcomadecisionaid.com. So we got lucky with that. And so it opens on the home page with what a decision aid is, right? It's to help you take an active role in making the decision. It's to learn what life might look like with each option, and to understand that there are unknowns with each option. So this homepage has a letter from me that explains just a little bit about the development and about what you might find in these 4 sections. There's information about direct quotes that are highlighted in yellow and how you can tell research from the quotes. A couple of pictures of Zoe before her amputation with her limb salvage surgery and then afterwards. And then there's an email where people can contact me if they have any questions or are in need of decision support while they're making the decision. Here we have acknowledged the Osteosarcoma Collaborative for their funding of this. And then I have a disclaimer at the bottom that this is only for general information, right? I'm not a physician. This information has been vetted by orthopedic oncologists though, so to make sure that the content is correct and accurate. And that disclaimer is on every page, just as a gentle reminder. I'm going to go ahead and move into the first section, which is about making your decision. So I started with common questions because that's one of the first things that comes up when a family is diagnosed and they're given options. And that's why am I even making a surgical decision, right? And that the answer is because the outcome is not contingent on the surgery. So the outcome of the same as far as survival is the same pretty much regardless of which surgery is being performed. So it really does allow for the families to have some input into what kind of surgery they're going to choose. And this idea of not making a decision at all or watching waiting is not an option with bone tumors. Things like these are included because it's part of the international decision aid to include, you know, what happens if I choose to do nothing. So this is, you know, in case you're wondering, doing nothing is not an option for this particular decision. There's some information about what is shared decision making. And then these gray boxes are all research links. So that was one of the things that came out of that 3rd study with families and parents, that they wanted more evidence and more research. And so these are research boxes that people can click and go directly to a study that they can read more about. These yellow boxes are the quotes, direct quotes from research studies. And so when I was testing this, I did test this tool with people who'd never heard of osteosarcoma, right? That's like most of us when we're diagnosed, just to see how they would navigate through it. And I had one mom who just skipped through everything and only read the yellow boxes. And she said she figured out pretty quickly that that was the direct quotes from families, and that's really all she wanted to read. So I thought that was kind of interesting. A little information about what is a decision aid. And then we have pictures sprinkled all through the decision aid of people who had bone cancer. And so this is, I didn't use anybody who had congenital limb differences because I felt that their outcomes could be a little bit different. And, you know, Piero mentioned that this is equally applicable to Ewing sarcoma. This is actually developed for any type of bone tumor. So it's not just osteosarcoma or Ewing sarcoma, but any bony tumor that might be around the knee joint. This little section in orange is really highlighted because decision aids are not intended to be used by just the patient community. They're always meant to be used with the surgeon and the family together. And that's what makes it shared decision making. And so in the research that I've done, we came up with 5 steps to making the decision, really understanding and knowing what your options are, depending on where your where the tumor is. Talk to your surgeon about where the tumor is and find out what the options are for you. Talk to other people who've made the decision. So this idea of the social support groups is real important. And I think that's why we have so much buy-in with this decision aid in the orthopedic oncology side, is because they don't always want to recommend social support groups, but I can. So they can say, hey, go to the decision aid. You can find all the social support groups there, like the Facebook groups and so on, that they might be more reluctant to mention. This idea of what's most important to you is sprinkled all through the decision aid, but it is one of the 5 steps to consider what's most important to you when you're making the decision. How active of a life does your child want to lead, or do you think they'll want to lead as they grow older? And then understand that there is uncertainty with every decision, that none of these decisions are really great, ideal options, right? But a decision will have to be made, and none of them are great. And then there's a section on making the decision with your child and the challenges that are associated with what we consider a surrogate decision making, right? When we're making the decision for somebody else. There's some different dolls and things like that that can help very young children to sort of normalize and relate to how their body might change. Lots of pictures and videos. These 3 girls on the right all have rotationplasty. The boy on the left, I believe he also has rotationplasty. Sometimes it's a little hard to tell just from the prosthesis, but all of these pictures were donated for the use of the decision aid. They all approved the use of them. Rarely do I use what we consider a stock photo, but occasionally I'll put one in, such as this one is a stock photo. And this is a little discussion about your child and their surgeon, right? Having the surgeon communicate directly to the child versus communicating with the parent. And then again, here's a study that's 6 things I wish I knew when my child was diagnosed with cancer. I felt like this was a really interesting and well done list that a mom put together. And so there's no need for us to sort of, what do you say, recreate the wheel when there's all these great resources out there. So I just include them in the decision aid. Second section is called Know Your Options. And so these are the 3 broad options, the 3 main surgical options. We have images for all of them. There are quotes in the yellow boxes. Research, here's a research study on limb salvage versus amputation. There's another one on bone cancer surgical options for the adult patient. We have quotes not only from patients and parents, but also from orthopedic surgeons. And then there are just each section for each option. And in addition to the content around pros and cons and possible issues, within each section, we have a couple of resources that are specific to that surgical option, and then several personal stories that include videos and things like that for each option. So all of these are just amputation, and these videos or these links are just for amputation. And then each section has a list of pros and cons, along with a PDF printable version. So that's something that came out of the that 3rd study with families. They really liked the ability to print them off, take them to their surgeon, look at them in hard copy, and so on. Here's the limb salvage surgery option. Again, lots of pictures. from the community, direct quotes, links. Here's what are the risk factors for and outcomes of late amputation, possible issues with limb salvage surgery, more pictures. Here's another research study about limb salvage surgery. And then just like we had with amputation, these are resources for limb salvage specific surgery, and then also some patient stories here. These are the pros and cons available on a PDF. And, you know, sometimes we look at the pros and we think, well, the pros are much shorter on this list and the cons are much longer, but you really have to weigh the, you know, the extent of the pros, right? Like you're keeping your leg. That's a pretty big pro. So these are not meant to be, you know, directly across. There's more pros in this one and so on. So it's a lot to think about, but at least everything's in one place. And this is the rotation plasty section. So we have lots of pictures, quotes from people with rotation plasty, possible issues, rotation plasty specific resources. Here are several, along with some videos playing basketball with rotation plasty. Here's a research study, why rotation plasty, and more patient stories. Here we have pros and cons for rotation plasty. Now, I know that distraction osteogenesis is considered one of the surgical options, but this decision aid is only for tumors that are located around the knee joint. So distal femur, proximal tibia, in the knee, only around that area. And so for distraction osteogenesis, after meeting with a number of surgeons, we agreed to include it here, but with the sort of caveat that it's more for when the tumor is located centered in the femur or centered in the tibia, so that the bone can be lengthened in that area. Same thing with osseointegration, not really considered a first-line choice for osteosarcoma or Ewing sarcoma, any bone tumor, but it might be further on down the line. And I included this one because I do see new parents joining Facebook groups, and when they're talking about discussions, they'll say, well, you know, I heard about osseointegration. You know, what about that? Why are we not talking about that? And so this is why. Then we also have a table here that are frequently asked questions with responses for each one. And this is also available as a PDF. This came from the patient community. And this is the last section for Know Your Options, the social support that I mentioned. These are all of the social support Facebook groups, and then also organizations that offer a peer support program. And so this decision aid is not a static tool. It's not permanent. It's somewhat dynamic and is intended to change. So as more organizations grow and there more peer support programs become available, we'll certainly add those to the list. And then the third section is all about communication, which was a big part of understanding what your surgical options are, how to talk to your surgeon. For many patients and families, you know, we have no experience in oncology. I didn't even know what an orthopedic oncologist was 16 years ago when my daughter was diagnosed. But we open with PACE, and PACE is an evidence-based communication skills training program. The creator is Don Segala, who started this, gosh, I want to say in the 80s. So it's been around for a really long time, and it's been used for prostate cancer, breast cancer, different types of diagnoses to communicate more effectively and confidently with your healthcare providers. So each letter in the word PACE stands for an action that you can do. But we fine-tuned these to be a little more specific for the bone cancer community. So P is presenting information. There's quotes. A is about asking questions. C is checking your understanding or clarifying what the plan might be. And then E is expressing concerns. And again, all of these are very specific for your orthopedic surgeon when making the decision for surgery. Lots of those yellow boxes with quotes and more research boxes here. Also in communication, or you and your surgeon, is that idea of second opinions. You know, when do you ask about second opinions and how do you go about that? So we've got some information here on how to support second opinions, especially if one of the surgeries is not mentioned and you need to find out more about that. And then here are the 20 questions for your surgeon. These have been, contributions were made to these questions in the bone cancer community, but also from the orthopedic oncologists and from prosthetists about surgery. So a big chunk of them, it looks like 12 of them, are about the surgery itself, but then 8 are about connections and support. A lot of people really find it a game changer to meet somebody live and in person who's had the type of surgery that they're considering. And so meeting somebody in person who has rotationplasty and seeing what they can do and watching them walk and hearing their story. Same thing with limb salvage and amputation. Actually meeting people is really helpful. So one of the questions you might ask your surgeon is, do you have any patients, who are willing to talk with me about my options? And then the last section is about life after surgery. So these are more, long-term considerations about what's important in the family's life, in the patient's life. And so these are questions. What matters most to you are values kinds of questions. These are things that we normally think about with our kids. But thinking about appearance, thinking about function, thinking about possible issues, these are all questions that that we suggest that people think about when they're considering each of the different surgeries. And then this idea of a new normal is something that came up quite a bit in the research that I've done in the community. This idea that, we don't really go back to normal. We move forward into a new normal. So no matter which surgery you pick, whether it's limb salvage, amputation, or rotationplasty, you're not going to go back to the exact same life and to the normal, the same body that you had before. It's unfortunate that we even have to use the word normal, but that is a question that comes from the community is, I just want my child to go back to normal. And so what the community members would really like new people who are newly diagnosed with bone cancer to understand is that you will have a new normal, and many people say it's even better than their previous life was. So these are questions to think about with the new normal. And then these are practice statements. They're available also as a PDF. And so these are statements to sort of try on to see how you feel. And as you see them now, they're just sort of statements and questions that you can read. Like, it's important to me that my leg looks as normal as possible. Do you relate to that or not? And so on. So kind of one of the next steps that I'm working on for the decision aid is I'm working with a group who would like to help make this section of the decision aid more interactive, so that as people are reading these, they can sort of sort them into what's most important and what's least important, and then review those for some sort of awareness of what option might be better for them. There's a section on what to expect after amputation and rotationplasty. And so this includes things like, thinking about the different kinds of prostheses you might have. So there are links here to some of the prosthetic companies that build them so that people can go on and look at these different types of devices. Here we have somebody walking their dog with a rotationplasty. This person has an above knee amputation. And there's a section on insurance, how to navigate insurance companies, how to talk to your prosthetist about insurance. And then there's also links sprinkled throughout the decision aid, such as this Amputee Coalition Prosthetist Finder. You can go to this link and go ahead and see if I can access it. You can go to this link and then type in your, I guess you click yet another link here, type in your zip code, and it will pull up a list of prosthetists near you. When people are making their decision and considering their options, that's one of the things that's recommended in the decision aid is that they find a prosthetist near them to learn more about what life might be like with a prosthesis when they're making that decision. And so this is my daughter Zoe on the front porch. She has a running blade now, so she runs with her blade. She was not able to run at all with her limb salvage surgery. So she went from age 12 to 23, not being able to run. And even then, it took her a couple of years to get to the point where she could run with her blade. And then this is life with limb salvage surgery and some things that possibly could happen. including having additional surgeries, possibly choosing to have amputation or rotation plasty later on. Again, research and patient stories. And then this last section is pretty big. And one of the reasons I wanted to start to create the decision aid was so that people didn't have to hunt these things down, because it's hard enough when you're dealing with a cancer diagnosis, a pediatric cancer diagnosis. You're in the hospital getting treatment, you're trying to make decisions, you're navigating all these other things. And so trying to figure out where these things live is really problematic. So these are all of the resources with the groups and the organizations included in here. Here's the Little Warrior Foundation here, several for osteosarcoma. There's a list of sarcoma centers. There are prosthetic companies, additional ones, along with their Facebook pages are linked. So I tried to put pretty much the kitchen sink in this section, as much as I could find that people might find useful, that I vetted or had other volunteers vet these for me. These are some camps and things for people to attend, limb salvage specific resources. And then there's more patient stories. So, you know, there were some that were included in the Know Your Options section, but there's additional patient stories here that people can kind of click through, including a section that's limb salvage surgeries first, and then a second surgery later. So these are 3 individuals who had a limb salvage first and then chose to have something else. Okay, so that's at the end. I'm going to stop my share and see if you have any questions about the development or about the decision aid itself.
Janet, that was incredible. And what I just want to kind of highlight before we take and field some of these questions is like, this is a one-stop shop for all the possible things that you would need to make an informed decision. But on that note, I kind of want to circle back to the inception of it. You kind of highlighted that it was born out of personal frustration, but I'm kind of curious to know, was there anything that informed the need to create this decision aid in your life pre-cancer? Like, what, it's one thing to identify a problem, it's another thing to create a solution to a problem. So kind of, can you kind of highlight and zoom in on how you arrived at the decision aid?
Yeah, you know, it really was born out of my daughter's experiences and others. So I quickly became a patient advocate. Before we had Facebook pages, we had ACOR, which is the Association of Cancer Online Resources. And that's where I met, you know, Pete Anderson at the Cleveland Clinic and kind of all these rock stars in oncology. And so I was hearing patient stories at the beginning. So without hearing patient stories and challenges that people had, it would have just been, you know, my own child's experience, but it just seemed to be happening again and again and again. Now, my background is in communication. It was not in health communication specifically, but I do have a master's degree in communication. So I've always been interested in stories, storytelling, language, linguistics, that kind of thing. And so hearing what people say about how their surgeons frame options, or unfortunately not framing options, because that's something I was hearing a lot too, is that the decision for limb salvage was made for them, even though options were available. And that's why I created the decision aid, to make sure that people weren't in the position that we were in 16 years ago, where we didn't know that options were available and we might have chosen something other than limb salvage.
Yeah, such an incredibly powerful resource. And like you mentioned, the timing of it too, and when you have to make these decisions, you like, I remember I couldn't even say Ewing's sarcoma for like the first month, let alone make a decision, informed decision on like what surgery Lucy's possibly going to have. So
I know, right? I stumbled over prostatitis in embarrassing ways to admit.
Right. So, all right, Emily, I'll let you field some of the questions for Janet if you want.
Well, I think the first question, I think, is one of my own, because your daughter diagnosed at 12, she kind of came to this decision over the course of 11 years. And I think, you know, you probably watched that decision making or these grappling with these types of topics through the eyes of a tween and the eyes of an adult. And do you find that there's an age group that this decision is hardest to deal with, or does each age group have their own unique struggles?
You know, it is very individual. That's a really good question. I will say I feel like I'm getting more inquiries from families who have very, very young children, where limb salvage is being recommended. And so I'm talking like 5, 6, 7 years old, really young. And so they're wanting to talk to people who have had limb salvage for many years and hearing what their outcome is. And so I think that's one of the hardest ages to deal with because they have so much growth yet to do. And, for young kids, some surgeons really recommend either amputation or rotation plasty because they can never really catch up, with the bone growth. But as far as it being easier or harder, it's just very individual. Young kids really seem to embrace the rotation plasty quickly because they want the option that is reliably going to help them get active, be active, high impact activities, things like that. Honestly, the group that struggles the most is parents. It's the parents who have to make the decision for their kids, especially when they're young kids. Well, I would say especially, but when they're young kids and you don't really know what their values are and what their interests are. If you've got a 7-year-old kiddo, you don't really know if are they going to want to play soccer? Or are they going to want to do these things and then be, not be able to do them if they have another choice? Or if they have an older teen, even 18 or older, who doesn't want to participate in making the decision. And they just say, I want you to make it, you make the decision for me. And that's really hard on parents because they understand this is a lifelong, decision, impacts their lives, their whole lives.
Yeah, it is. It's a tough decision for parents for sure. I kind of want to keep on the theme of Zoe, if you're all right with that, with the personal experience. You kind of alluded to the fact that she had limb salvage surgery initially, and then much later on decided to have rotation plasty. Was that purely a quality of life? Like, what were the factors that weighed in on that? Because I know you're very pro one way versus the other. And can you comment on that a little bit?
Yeah. And I should say that, she always wanted an amputation. At the very beginning, I kept notes and I remember, but when she first went in, she asked about amputation and her surgeon said, we don't amputate anymore. We can save the leg. And so me being, new to the community, I'm like, what am I going to say? No, cut it off. Save the leg. Every parent wants to save the leg. And so I didn't know what questions to ask, but every year she asked for an amputation. It wasn't like she got to the point. It was something she always wanted. But so she definitely wanted, she had chronic pain. She had a lot of pain. She had a lot of mobility issues. Most of her high school years were spent in a sort of an electric scooter or on crutches. She was on arm crutches for a lot of the time. So she was done. She was pretty much done. Finding somebody to amputate post-limb salvage was problematic because, and I talk about this in the decision aid because, we think, why don't we start with limb salvage first and get an amputation later, right? We can always do that. But what we don't talk about, what surgeons don't always mention, is that the amputation later is going to have to be above the metal implant for a limb salvage, which means you have a much shorter femur to hold the prosthesis. And so if you had chosen to amputate earlier, you would have a longer limb to hold the prosthesis. So, but yeah, she was kind of done with the pain and the constant surgeries. And she had so many plans, to take trips with high school or college, and they would get canceled again and again and again because they had to have another surgery. Some people do well with limb salvage. I don't want to,
right.
I don't want to bash limb salvage. Some people do quite well with it. They do generally recommend no high impact activities and to expect surgeries, additional surgeries over time. But we can't really predict who's going to do well with limb salvage and who isn't.
Cool. Thanks for that. We'll get into the questions now because there's quite a few of them. Emily, do you want to tee one up?
Yeah, there's kind of I'll smash two into one. But talking about, spreading the word about this resource and, is there a way to know kind of which doctors or hospital systems are using and recommending this resource, or alternatively, kind of what's the best way we Little Warrior and we, the greater patient community, can spread the word?
Yeah, that's a great question. The best things we can do as community members is to share it with our surgeons, make sure the surgeons know about it. We need to get this tool in the hands of the surgeon and just continue to post them because, people are but they're getting diagnosed. They find the Facebook pages and they ask the same question again and again. So I've already kind of decided the best way to keep it at the surface for patients is to post it at the beginning of the month, the first of the month, make sure it's at the top of the page so parents, newly diagnosed families can see it. But thankfully, we have buy-in from institutions nationwide. And this is actually going to be presented at the Musculoskeletal Tumor Society in Banff. And that's where all the ortho-oncs go. So they are hugely supportive. I have had so many surgeons contact me. They call me, they email me. I don't know them. And they say, I want to use this with my patients. I'm going to use this with my patients. And so that's the best way to get this used and get this information to people quickly, is make sure the surgical community knows about it.
That's awesome. It's obviously, go ahead, Emmy.
Well, I was going to say, just as perhaps a follow-up on the osteo side, how rapid is surgery after diagnosis? I know with Ewings, there's usually, several rounds of chemotherapy first. Is it a faster turnaround in osteosarcoma?
It's about 2 months post-diagnosis. They do 2 cycles of chemo. Yep. And then they, so people have, I would say, anywhere from, 6 to 8 to 10 weeks, depending on where they're at, before they have to decide. So they've got a little bit of time. But also not much time.
Not much time. Never enough.
Never enough. All right, transition to the next question here. Are there any thoughts about offering the decision aid in any other languages to increase access of this incredible resource?
Yep, that's next. We're going to have it translated into Spanish and other languages. There is a surgeon from the Philippines who is translating it now to 2 different dialects in the Philippines. So he's kind of doing that on his own and keeping me posted on how he's doing, which is phenomenal for a month's release that it's already getting translated. But absolutely, we will get it translated.
Awesome.
There's a question about dealing with your doctor's bias. And are there materials? I know you showed us the PACE section, but dealing with the doctor's bias and overcoming that and further kind of self-advocacy.
Yeah, and you're right. There is some in that about you and your surgeon. That's kind of what the second opinions are for. I hope to collate a list of surgeons who offer like virtual visits for second opinions, because traveling when we're in chemo or in treatment is hard, if not impossible. So if we can have additional consultations, then that would be really helpful. But yeah, learning how to ask for second opinions. People don't often know how to do that. Sarcoma centers are used to that. So we do have a list of sarcoma centers. Asking, people in the support groups, how to navigate that, and introductions to surgeons is really helpful. Yeah.
Okay. But keeping on the topic of surgeons, do you find the ones that you surveyed, they are preferential to one procedure versus another? And how does that factor into the decision aid guide and their input?
Yeah. Surgeons are trained to save the limb, right? That's part of the medical training. You save the limb. But what many surgeons see over time is that, saving the limb at all costs is not always what's best for patients. So those tend to be the people that are the most involved with me. I will say that when I first started doing this work in a serious and guided way about 6 years ago or so, some of the surgeons I worked with were still really pushing limb salvage. And over time, I'm seeing sort of that pendulum swing a little bit over to rotation plasty as being offered more often. Obviously a surgeon who believes that limb salvage is like the best thing, no matter what, they're not going to be as engaged with a tool like this, which is why we also want to make sure that it's on the Facebook groups and accessible to patients, because just because that one surgeon doesn't do rotation plasty or isn't supporting it doesn't mean that it isn't an option for you. But I will say that, and it's not just, people are like, oh, it's probably the new young surgeons that are, supporting this work. And it's not. We have so much support with surgeons who are getting ready to retire, because they've seen this play out over time. But, the unfortunate reality is they don't get to see what people's actual lives are like. And so getting these stories published about what it's like for people over time is really going to raise awareness to the surgeons about what's possible. And, for a long time, rotationplasty was not really recommended for adults because why? It's not in the literature. We don't have published research on it. And I just recently met a surgeon who recommended rotationplasty for an adult with bone cancer. And it's like, holy cow,
Wow.
that's the first I've heard of that. So that's huge.
Yeah.
And I'm hearing that more and more, that it's being recommended more for people who want to live very active lifestyles, whether they're involved in sports or that they tend to recommend rotationplasty more often. So not as
Awesome.
much pushback now as I had even 5 years ago.
Mhm.
It's kind of like you created this guide and you have that data now, right? You have that long-term follow-up, these testimonials.
Yeah, we don't have that much data, like published data, but we're getting there. We're definitely getting there. There's a new musculoskeletal tumor registry. There's talk of having a rotationplasty registry. We're starting to develop ways to track people over time. And that's really going to help push the data so that, one of the questions that we have from patients right off the bat is like, if I choose limb salvage for my kid, what are the odds or what are the chances that they're going to have an amputation or a rotationplasty later? And the answer is we don't know because we don't track it.
All right.
That's a problem.
Interesting. Do you find that geography is a limiting factor in some of the decisions being made? It's one thing to travel for a big surgery, but then finding a prosthetic resource in your area who's skilled in rotationplasties if you're in Wyoming or far from a major metropolis. Do those people have different considerations in this, or do you find that these solutions can all be managed anywhere?
Yeah, along with the sort of support that we have for the surgery comes the need for trained prosthetists to create the prosthetic device for rotationplasty. And I think there's definitely room for building that out. We don't have a ton of people trained on that. So there are people in other countries and in, as you say, more rural areas who are considering rotationplasty. And when I encourage them to meet with the prosthetist near them, they've never built one before. And so, getting training, that's another thing that we're working on in terms of medical education, is to make sure that we're getting more prosthetists trained in how to build the devices so that people can be active. We had a rotationplasty camp for kids right here in Indiana last fall, and it was very successful. There were a lot of people came from, North Dakota and California and New Jersey and Florida and Texas. They came from all over to go to this camp. And there were some kiddos who had a prosthesis and they were kind of limping around. Well, there were a couple of prosthetists who were trained in making devices for rotationplasty, and they just made some simple tweaks that really helped to improve the design. And so they're willing to work with prosthetists in other states. But, once the initial device is built, going back and having subsequent molds is not that problematic. They might have the same device for 2 or 3 years or more, depending on how much growth, the child is going through before they have to switch out. But yeah, definitely something to think about for sure.
Awesome. All right, we're running low on time here, so we've got 5 minutes and we'll try to get to the remaining questions here. Here's an outside of the box question. And this is a relevant topic. Does AI at all play a role in this model? And if so, are there any concerns about the impact of AI on this topic? Do you have any idea or thoughts there?
I do not. I'm still learning about how AI might help in decision making, and I'm a little reluctant to embrace it just because it's so highly personal, right?
Right.
Yeah. So the answer to that is I don't know, but I would be interested in learning more about it if the person who posts wants to have that discussion. I do know people who are involved in AI, but it's not necessarily for these purposes or even for in medicine, right? It's for other purposes.
Right.
Yeah.
Sure. Emily, did you have any other questions, or we can kind of wrap things up too? Go
You
ahead.
said one more come through about just do most hospitals, the support staff like child life or social workers, are they actively working with the families through these kind of the emotional, financial, the entire spectrum of this, or are most families forging this on their own?
You know, it's a real mix. And, you know, I'm only privy to small windows of what people actually go through. Sometimes their social workers are very involved in helping them to navigate this. But sometimes they have no access. So, you know, usually when social workers and people like that get involved in the hospital, the decision's already been made. But not always, you know, because they're in treatment for osteosarcoma a couple of months ahead of time. But, you know, we don't know what questions to ask at the beginning of diagnosis. So that's a problem. But yeah, sometimes they can be helpful. Honestly, if people are considering rotationplasty or amputation, talking to their prosthetist and having them take a good look at their insurance, they're our best friends for that. They know how to jump through those hoops.
Awesome. Well, Janet, I just want to close in saying that you are getting a lot of love in the Q&A box, and I just want to read some of these. This is an incredible resource. Thanks for putting this together, this comprehensive guide. Thank you so much for all your hard and valuable work. Thank you so much for all your passion and your hard work. This is helping so many work through this terrible decision. And then there's one comment even across the pond in Europe that's saying, thank you for your great work. You could share this on a new research or a new platform that's called beatcancer.eu/community. So I can share that with you after the fact.
Yeah,
but,
yeah.
A lot of love here. And from the Ewing sarcoma community, thank you for sharing this resource with us and giving us a preview. I encourage all to go to osteosarcomadecisionaid.com and check it out, because it is such a comprehensive guide that, you know, even in your overview, that we skimmed over a lot of resources that are there. And so I implore all to use it and help disseminate this incredible resource that you put a lot of time and energy to. So thank you.
Well, you know, it came from the community. It's not, it was, you know, some time and energy on my part, but it's really built largely from the families and the surgeons. They see a need for it too. And I will say that the next step, you know, you asked about dissemination, Emily, coming from one of the questions. The next step is to have this decision aid automatically populate in the EHR, so that when somebody is diagnosed with bone cancer around the tumor, the decision aid pops up and the surgeon can say, here you go. Here's a tool that we can use. Go, you know, take a look at this and we'll talk about your options. And even better, have it sent out through a patient portal. So that's kind of the next steps, is to make sure that people are getting it at diagnosis.
So awesome. Last question for me is, like, big picture. What is your greatest hope that comes from this decision guide?
You know, that it's used. That is my biggest hope, that it's used. And honestly, it's getting used now, which is super exciting. But this is this little window of time. Yeah, we have that 950 people, you know, looking at it, but that doesn't mean that that's gonna, you know, continue. And so just making sure that it's getting into people's hands at diagnosis, that they're finding it useful, that they're feeling informed, and that they're happy and satisfied with the decision that's ultimately made. That would be a dream.
So awesome. Well, thank you for your time, and thank you for being here with us, and thank you for presenting this awesome, amazing resource. Incredibly impactful. Thank you for all our viewers today for joining us as well on this fascinating discussion. We do have a follow-up survey. So before I close things out, please stay logged on, because you'll be prompted. It's a simple 9-question survey to see how we're doing and how we can get better. I'll take you all of 5 minutes. We will see you back here again in July. We don't have exact date or topic nailed down yet, but you can subscribe to our Ewings U email list, and you can go do that by going to littlewarrior.org, navigating to the Ewings U tab on our website. You can always hear about our next speaker as well on Instagram and Facebook, as we always post them that way as well. And lastly, Janet, I don't know if you know about our sign off in closing. We have a sign off at Little Warrior that embodies our fights. You do know about it. All right, awesome. In honor and memory of so many little and big warriors who have faced this cancer, that's how we sign off on all our communications, both internally and externally. So if you would, on the count of 3, please join me in a simple swords up. So 1, 2, 3.
Swords up.
Swords up, everybody.
Swords up.
Thanks for being here. We'll see you next time. And please don't forget about the survey. Thank you.
Thanks for your good work.
Thanks for
Take care, Janet. Bye.